Erectile dysfunction, or ED, can make it difficult for a person to achieve or maintain an erection. Following certain diets or eating specific foods may help contribute to successful treatment. This article examines what foods people could include in their diet to help combat ED. According to the National Institute of Diabetes and Digestive and Kidney Diseases, ED affects roughly 30 million men in the United States. A person's chance of developing this condition increases with aging and taking specific medications, including antidepressants and blood pressure drugs. Smoking, being physically inactive, or having a health condition such as type 2 diabetes or heart disease can also lead to erectile function problems. In addition, one article notes that the main cause of ED is poor vascular function. As a result, the risk factors for ED are the same as those for cardiovascular disease. A 2018 study with participants aged 18 to 40 years old found that those consuming a higher amount of flavonoids in their diet improved their ED. Flavonoids are a subcompound commonly found in fruits and vegetables. They are part of their parent compound, flavonoids, usually found in teas, fruits, and vegetables. The concentration of flavonoids in specific foods includes chamomile tea, bergamot juice, artichoke heads, kumquat, and bell peppers. However, a food's number of flavonoids displays in ranges. For example, bell peppers can have 0.1 to 12.9 milligrams of flavonoids per 100 grams of fresh weight. This may indicate that the source quality of fruits and vegetables has an effect on the number of flavonoids in the final product. Products that claim to improve erections often rely on a combination of ingredients, including those that may support blood flow, hormone levels, and overall vascular health. It's important to consider the full profile of ingredients and their proven effects rather than focusing solely on one component like flavonoids. Consulting with a healthcare professional is the best way to get personalized advice on products and their effectiveness for your needs. If you like this kind of content, please give it a thumbs up and subscribe button. Now let's continue. According to research, the following foods may have properties that help to prevent or treat ED. Berries. A 10-year prospective study of 25,096 middle-aged males indicated that those who consumed the most flavonoids had a 9 to 11% reduced incidence of ED when compared with those who consumed less. The authors observed that the chance of ED reduced by up to 19% in those who ate the following 5 flavonoid-rich berries and other fruits: strawberries, blueberries, apples, pears, and citrus fruits. Salmon. A 2016 study of rats looked at the relationship between omega-3 fatty acids and ED. The study found that a higher intake of omega-3 helps lower physiological damage, which in turn may lower ED. The National Institutes of Health lists cold water salmon as one of the most fundamental foods for omega-3 intake. Farm-raised salmon may have slightly fewer nutrients as omega-3 comes from the algae, which is not common in fish farms. The levels of omega-3 in farmed salmon largely depend on what the fish eat. For higher intakes of natural omega-3, individuals should consume more wild salmon from cold waters. Olive oil. A 7-year study of clinical trials examining the relationship between Mediterranean diets and ED lists olive oil as a beneficial ingredient. However, the study only examines virgin and extra virgin olive oil. This could be because any oil that goes through a refinement process changes its molecular structure. The study looks at what refining does to food oils, including olive oil. It shows that it can destroy antioxidants and omega-3 anti-inflammatory properties. This also removes the properties that could benefit ED. Individuals who want to incorporate oils in their diets for ED and other health benefits should consider unrefined and extra virgin olive oil. Whole grains. A 2017 study also examined the effects of grains on ED. The results conclude that a Mediterranean diet, which includes whole grains, is more beneficial to treating ED than a low-fat diet. This could mean that a healthy, balanced diet that includes whole grains without potentially harmful additives such as pesticides can benefit individuals with ED. However, researchers should perform more studies to understand the overall health benefits of whole grains, particularly in comparison to keto or low-carb lifestyles. Nuts and legumes. A 2020 study found that eating nuts and legumes may help lower ED. The Agriculture Research Service states that legumes are the only natural food containing catechins and epicatechins, compounds that make up one subset of flavonoids, flavan-3-ol. However, there are no studies that compare the differences in each type of nut or legume and its realistic effect on ED. Herbs and spices. The Agriculture Research Service also lists herbs and spices that have high amounts of flavonoids. These include parsley, thyme, rosemary, chives, tarragon, and oregano. Meats and poultry. A food component that could benefit ED is L-arginine, an amino acid found in protein-rich foods. 2017 research suggests that L-arginine levels are lower in males with ED. The body uses L-arginine to make nitric oxide. This is a molecule that widens and relaxes blood vessels, increasing blood flow to the penis. Foods that are good sources of L-arginine include poultry, red meat, fish, nuts, and dairy products. Learn more about foods that are high in L-arginine here. Leafy greens. Nitrates are food compounds that can increase nitric oxide levels. Research suggests that they may also reduce blood pressure and inflammation. Foods that contain high levels of nitrates include arugula, spinach, lettuce, and radish. Tea and coffee. A 2020 study states that teas increase flavonoids as part of a healthy diet. One 2018 study examining the impact of coffee on ED found that long-term coffee intake is not associated with the risk of ED. In fact, since coffee contains antioxidants, moderate levels may help build resistance to inflammation. There are some foods that a person may wish to avoid when managing erectile dysfunction, including sugar. According to Action on Sugar, regularly eating foods that include substances considered unhealthy or drinking beverages containing sugar can lead to weight gain and a high body mass index, or BMI. An older article notes that excessive body weight and an increase in BMI can lead to erectile dysfunction. The researchers state that in 2014, there were 8 million cases of erectile dysfunction that were related to diabetes and obesity. High-fat meals. People who have high cholesterol levels, high blood pressure, obesity, and those who smoke may have an increased risk of developing atherosclerosis. This occurs due to plaque buildup in the inner lining of the arteries. As a result, this reduces the oxygen supply and blood flow to the organs. In addition, according to Wayne University School of Medicine, men who have clogged heart arteries may also experience issues in the arteries that supply blood to the penis. Alcohol. Alcohol can also affect a person's sexual health. An older article found that 72% of men with alcohol dependence had one or more sexual health problems, such as premature ejaculation, low sexual desire, and erectile dysfunction. Excessive alcohol consumption can also reduce blood flow to the penis, so individuals may not be able to achieve an erection. When to consult a doctor. A person should contact a doctor if they experience any of the following symptoms of ED. They can get an erection sometimes, but not every time they want to have sex. They are not able to maintain an erection during intercourse, or they are unable to get an erection at any time. A doctor is likely to ask the person about their medical and sexual history. They may also examine the person and perform some tests. If the doctor diagnoses the person with ED, they can then recommend treatments. They may also advise certain lifestyle changes that research has shown to benefit sexual function. These may include the person doing more exercise, quitting smoking, limiting alcohol consumption, and reaching a moderate weight. It is also important for individuals to consult a doctor to rule out any other potential health issues, such as cardiovascular disease or high blood pressure. Summary. Those with ED may find that eating certain foods and maintaining a healthy diet helps their symptoms if they are unable to take medication or find it ineffective. However, a person should consult their doctor if they have symptoms of ED. The doctor may also want to discuss any potential coexisting health issues. People should also check with their doctor before taking any supplements or increasing the intake of specific foods, especially if they take other forms of medication. Thanks for watching, everyone. If you found this video helpful, make sure to give it a thumbs up and hit that subscribe button for more content on holistic wellness. Don't forget to click the bell icon so you never miss an update. Share your thoughts in the comments below and let me know what topics you'd like to see next. Stay healthy, stay happy, and I'll see you in the next video. The information provided in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. The creators of this video do not endorse any specific product, service, or treatment mentioned. Reliance on any information provided in this video is solely at your own risk.